I'll give you a moment. And once you get settled in this virtual Zoom room, we'd love for you to go ahead and put your name in the chat box and say hi. We will be using that chat box throughout the session today. But we're going to talk about the role of transformational prevention leadership during COVID and beyond. And I am your producer, Dave Clausen. I'll be in the background running the polls and chat box. So if you have any technical difficulties, please don't hesitate to send me a message in the chat box and I'll be here to help out.
Thanks, Dave. Thanks, Dave.
Mm-hmm.
So welcome, folks. It's wonderful, wonderful, wonderful to see you all coming in. Grateful that you're here. I am so grateful for this opportunity that is offered by our wonderful partners at DSAM to have this conversation with you all. And we've been conducting this series, and it's been going really, really well. And we thought that it would be important for us to really take a moment to have a conversation within the context of the work that you all do in this current time that we are in. And so today, we're going to do just that. I'm going to share with you some insights that I have with respect to some of the work that I've been able to do throughout the country, and the lessons gleaned from that, and engage with you with a conversation that we're wanting to have about that. And so welcome, thank you. I am being supported by my great friend and colleague, Dave Clausen, who already introduced himself. One of the things that he did not mention is that he also happens to be a co-director for the Mid-America Prevention Technology Transfer Center, which provides training and TA resources and support through four states within the middle of the country. And so we are really, really honored to have you, Dave, as a part of the team that helps to make this possible for us. Dave will be engaging with you all through the chat function. And so this really is intended to be not merely a didactic presentation, but while we are presenting, provoking ideas that will engage you in the midst of the conversation, so that we might be able to learn with and from each other. I am really grateful to the Division of Substance Abuse and Mental Health for providing us with this opportunity, and grateful that Abby is here with her leadership in providing this opportunity. And I wanted to make sure that Abby, you had an opportunity to welcome and share your thoughts with the folks.
Thanks, Carlton. Yeah, just want to say a quick welcome to everybody. I'm Abby Wilson. I'm the project director for the Strategic Prevention Framework Prescription Drugs, or SPIF-RX grant, and want to welcome you all to today's session on behalf of DSAM. We've been really, really happy to partner with Carlton Hall Consulting over the last 2 months or so on this series of 3 trainings. And that's just 2 months for SPIF-RX, not for general DSAM. And we're looking forward to more trainings in the future. Our first session in July focused on equity and trauma-informed prevention, and our second session was on the Certified Prevention Specialist exam. This last session is on prevention during COVID-19 and beyond, and we're really looking forward to it. So pass it back to you, Carlton, and thanks everybody for being here.
Thanks so much, Abby. And so, as Abby mentioned, this is being supported by a grant that the state is receiving from the Substance Abuse and Mental Health Services Administration. And as such, I am obligated to share with you that the views that I will be expressing are my own, okay? As well as kind of based upon the work that we do. but they do not necessarily represent the views, policies, and positions of the Substance Abuse and Mental Health Services Administration, or SAMHSA. And so they're off the hook with respect to whatever it is that I'm going to present. But folks, we're really looking forward to having this conversation with you guys. Note that this webinar is being recorded. And so you'll have an opportunity to come back after the session is over, probably by Monday or so. We will likely have an email out to all of you to provide you with a link to the recording, as well as a link for evaluation of this webinar, because we really, really do value your feedback and input. So with that, I wanted to share with you kind of the impetus of this conversation. I had a wonderful opportunity to work along with the National Alliance for Drug Endangered Children, which is a national organization really focused on looking out for the harms that are associated and the risks that are associated with exposure to drug use, possession, manufacturing, all that we kind of address and deal with, and trying to protect children in that context. As I was speaking with them, the Drug Enforcement Administration came out with a report that indicated that the actual proliferation of opioid pills was far greater and damaging to our nation than we had originally thought. In fact, if you look at this picture of the US and this depiction of the US, it indicates by county the proliferation of opioid prescription pills that were associated with each of these of the counties. In a nutshell, wherever you see purple is in trouble, is in danger, and there's a lot of purple on this map. What I will say to you about this is that what it got me to thinking is that this, in a real sense, represents our home, our house, so to speak. And it struck me because I'm very sensitive these days to the vulnerabilities that are inside our home. My wife and I, very, very recently, became grandparents for the first time. 3 years ago, my son and his wife gave us our first grandchild, Ethan, and then 10 days later, my daughter gave birth to twins. And if you're doing the math, that's right. We went from 0 to 3 in 10 days. And if you're listening to me, those of you who don't know, becoming a grandparent is an absolutely incredible, life-changing experience for me. I love my grandchildren and want to spend every moment of my day with them, even though 2 live in Spain and 2 live in New York, and so it's very difficult these days. But when I go to visit them, what is interesting is when I see them, I come into their home and I notice that the home has changed. I notice that even though I have a couple of degrees, for the life of me, I can't figure out how to navigate the stairs and open that daggone thing. I find when I go into the kitchen to look for a snack, I can't open the cabinets. I can't even charge my phones because I don't know how to manage this. And I don't mean to be crude or obtuse, but I will tell you that there are some areas of the home that you do not want restricted. That all being said, I'm sharing all of this because what is remarkable to me is in this home, I want you to put in a chat box who's the priority in this home? Just put this in the chat box. Who is the priority in this home? Am I the priority? Dave, what do you got?
All right, I got the children, and your audio is actually coming across a little choppy and broken on my end.
Got
But
it.
we've got
Thank you.
children, toddlers.
Got it. Thank you. Thank you. Absolutely. The children are the absolute priority. There is absolutely no doubt in our mind who the priority is here. Prevention is overt. Prevention should be intrusive. Prevention should be blatant. There should be no doubt who the priority is in our home, in our nation, with respect to prevention. Prevention is about protecting the most vulnerable. And if we take that analogy just a step further, I will share with you that the greatest portion of our role in this current context is that we are building bridge. We are finding ourselves in a unique time when public health and criminal justice really is merging in our conversations. And the cornerstone of that bridge is prevention during these times and these days. And so what I want to share with you is that, as Dr. King mentioned, we are living in some fiercely urgent times. Never before in our nation's history had we have the conflation of not only and not merely the greatest and most tragic epidemic of overdose deaths that have occurred and since we've been recording these numbers. But that's all happening at the same time as are currently having a conversation around the greatest movement for legalizing drug use. And those two things are producing a moment for us where, as preventionists, we are needing to address and manage and help our communities navigate that conversation in a way that should be protective of our most vulnerable in our population, right? And so, literally, one experience that I've had working with the the Drug Enforcement Administration throughout the years, partnering with them with their DEA 360 strategy, where they were engaging communities in conversations about the opioid epidemic that was occurring in our country. As I was going around the country, I come across one county, and I will say to you that I know I've been living in the DC area far too long, because almost everything I do now, I feel the need to redact. But if you are looking at this, what you're looking at is that right the day before this meeting occurred, the CDC offered their latest report, their latest annual report of the numbers that were associated with the dangers aligned with the opioid crisis. And of course, they were alarming. They've been alarming across the nation. Well, they were alarming into this county as well. And this acting prosecutor decided to bring together all the concerned citizens about this because of how incredibly urgent the situation was. Can you look at the picture and tell me what you perceive to be wrong with that picture? What's wrong here? Just indicate that in the chat. Dave, are you seeing anything?
Not yet. And your audio does still kind of come and go as far as its choppiness.
Got
It
it.
was good there for a little bit, and then it went back to being choppy. But
Thank you so much.
so let's
So,
see. Drop it in the chat box. What's wrong with this picture? All right, here we go. Karen says, sparsely attended and may not reflect the community diversity.
exactly, Karen, exactly. And I will tell you that even in, because I know these folks, This picture is actually worse than what it looks like because this woman actually works for that man. So it's actually a worse situation than even what the picture indicates. But you're exactly right. We really ought to be having a new conversation. And that conversation is about engagement. And that's really what I wanted to take a moment to have a conversation with you all about. That's really what this presentation is about. What is needed now is for us to be thoughtful about how are we engaging the broader community in this conversation of change. That's absolutely essential. So I'll start off with this, and forgive me for those of you who have been with me before. You probably have seen this, but I want to go through this really, really quickly because there will be a point to this. If you're looking at this picture, how many holes, if this was an actual shirt, how many holes are you seeing there? And just, I'm going to give 10 seconds for this. How many holes are you seeing?
How many holes? We got 8 in the chat box with a question mark next to it.
Mm-hmm. What do you see, folks?
8. Got another one. All right, keep them coming. Few
Good
more
deal.
moments.
Absolutely. So you're exactly right. There are 8 holes there. And if this were the case, some of you have seen this before, you will see that the front of the shirt would have a hole, the back of the shirt will have a hole. That actually represents 2 holes. Here's another 2 holes, one in the front, one in the back. Here's one for your body to go through and one through your head. So that's 6. And then the other 2 for your sleeves. And so that's exactly right, 8 holes. But I will say to you that very often we misinterpret what it is that we're seeing. And I think we do the same with respect to the narrative that we're having as a nation. The narrative is often filled with holes that I believe, as a preventionist, we need to be attentive to. What am I talking about? Many of you are employing federal grant opportunities, such as grant opportunities from the Department of Grant opportunities such as coming from the Centers for Disease Control, the Drug-Free Community Support Program, such as the Partnerships for Success grant opportunity from SAMHSA. Well, what each of these grant opportunities have in common is that they, in a real sense, are really requiring us to bring prevention science to a broader community, to the broader population. That's really at the core of each of these funding opportunities and many more that are facilitated with and through the help and support of the state. Well, I will share with you that that really requires us to have a different kind of leadership. That's really important to have to be able to do that because we are not doing as good a job at reaching out and engaging the broader community in these conversations around prevention science. The type of leadership that I believe is necessary is called transformational leadership. And transformational leadership is not like your typical transactional leadership. It's not the kind of leadership that is really employed by, say, a CEO of a business or the executive director of a nonprofit. Transformational leadership really is about the systems, the tools, and the tactics, the process of engaging others to create an opportunity to build change. And so transformational leaders are pretty well known. You know them when you see them. There are multiple kinds of characteristics that a transformational leader utilize. When you think of a transformational leader, tell me what kind of characteristics are you do you notice with transformational leaders? What are some of the characteristics that you would know? Please put that in the chat. Folks, I shared with you that we are going to have a conversation back and forth, and so this is not just me talking, but you engaging. Anything coming up, Dave?
Motivating, empowers others, a risk taker, some kind of charisma that draws people in.
Absolutely, absolutely. We know transformational leaders when we see them, and the core of transformational leaders is that they all exhibit the same kinds of qualities. And these qualities, I will say to you, are important if we're going to engage communities in the process of change. They are having a clear vision, serving as role models and being able to be clearly seen as a role model. They're intangibles like building trust or promoting peer problem solving, looking at how and ways in which we build involvement and inclusion in the projects and efforts that we are engaged with. And more importantly, they give meaning to the work. They give meaning to your organizations. As preventionists, I have so many experiences with communities and organizations and coalitions that know how to say what they do, but they, in the words of Simon Sinek, are terrible at explaining the why behind what they do. And looking at becoming more of a transformational leader really is about the fact that people buy what you do, they don't buy why. People don't buy what you do, people buy why you do it. We have to get better at expressing what is the core of the why behind the work that we do if we're going to be successful in doing this. And I say that if we're going to do that, and if I go back to the analogy of the shirt, the shirt really represents, you can't really solve a problem unless you're able to see that problem clearly to me. And there are holes in the narrative that we're having as a nation that I believe have to be seen before we can mend them. Case in point, here is a statement a quote that I love from the President of the United States. The statement really is a challenge that I believe that we have as preventionists. One problem meriting special attention deals with the growing abuse of non-narcotic drugs, including barbiturates and amphetamines. And here's the real key point. Society's gains will be illusory if we reduce the incidence of one kind of drug dependence only to have new kinds of drugs substituted. Illusory if we reduce the incidence of one kind of drug dependence only to have new kinds of drugs substituted. I refer to that as the whack-a-mole effect, right? It's opioids today, it's vaping tomorrow, it's meth the next day. We are still in that cycle, and just to be clear, these are not the words of our current president, nor are they the words of our most recent past president. These are the words of President John F. Kennedy, who shared these words a week or so after I was born in 1960. That interference was mine, Dave. Use and engage a poll to kind of illustrate this point a little bit. Dave, could you show the poll? Which way is the cat going, up or down? All right, can I have no more? All right. So now we're getting a little bit of dissension here. All right. All right, Dave, I'm going to close the poll. I'm going to close the poll here. So, majority of you think that that the cat is going up, and some of you are choosing that the cat is going down. I will be clear and share with you that the cat is going whichever way we determine the cat is going. And the reason I like this picture, what it really represents is that it really is a metaphor for me for the kind of conversations that we are currently having nationally about our work in prevention and our relationship to substance misuse issues that we are facing. To be clear about this, if you look at the data represented on this graph, what you will see are trend data that's associated with high school seniors reporting past substance use over the course of 1975 through 2016. And I now have new data that takes this further that I'll get into later. But if you look at this very clearly to prove the point, alcohol, a wonderful trend going down, right? If we look at cigarette use and marijuana use and we look at illicit drug use, this is going in a positive direction, right? With the exception being marijuana, which here is ironically green. What I will say to you is that around this time is when we really started to get a real a consistent push for legalizing marijuana in its various forms, whether medical usage or recreational usage really began to take hold. I think that in the country, the narrative got to be a bit mixed, which changed perceptions of this harm. And so we see where use is actually going up with respect to marijuana use. We look at this and ask the question and talk about who are the high school seniors that are claiming that they are abstaining from all drug use, whether alcohol, cigarettes, marijuana, or other illicits. We also see this as a very positive trend going up, right? If we think about alcohol and alcohol among teenagers, that trend is going in a very, very positive direction. The point that I'm making here, folks, is that prevention is working. But the narrative across the country gives a very mixed picture of that. How many of you will agree with me that much of the conversation about drug misuse in our nation and the efforts towards addressing drug misuse have been defined by one key phrase: the war on drugs has failed? And what I'm sharing with you is that one of the holes that we need to mend in the fabric of our national discourse is that prevention absolutely is working. And we're going to get into that. I have a conversation about how we need to reframe the thinking of the kind of leadership that we need in prevention in the midst of this current national context. So part of what I believe is at issue for us is that often when we talk about these things, particularly among ourselves, we look at the charts, we have our survey results, we understand what the data say, and we tend to talk about these issues in really kind of clinical, sterilized kind of ways, right? The prevalence is this, and the impact is that. In a very real sense, what we're really addressing are the consequences that are happening within the context of our social systems, within the context of our communities. That's what our communities care about, right? And so it's not clinical, it's not sterilized in the minds of the community members whom we want to engage in our conversations. And so we have to do a much better job of drawing the linkages between the work that we do and these very real concerns that our communities have around the consequences associated with it. So as I begin to have this conversation, I want to check in with your perceptions about what's going on in our current context. So I have a few polls. There's going to be about 4 or 5 of them that I want to put up in kind of rapid succession just to get your insight. The first poll that we can launch, Dave, is: are opioid overdoses increasing or decreasing now? What's your perception out there?
While they respond to this poll, could you check the plugs for your mic? Your audio is still going kind of choppy off and on.
Thank you. Doing that now.
All right. We've got 4 folks have voted, 5 have voted. A couple more folks to let us know what you think.
Got it. Got it. Thank you. Thank you. Mixed. Excellent. Let's go with the next one, Dave.
Mm-hmm.
Oh, sorry. Is prescription opioid misuse increasing or decreasing? So again, a bit of a mix, about half and half. Got it. Got it. Let's go to the next one. Marijuana use. Is marijuana use increasing or decreasing? All right, okay, I will admit this was the gimme. this was the gimme. All right, very good, very good. And then the next one, marijuana use, if I think about this in terms of gender, increasing or decreasing? Got it. Most of you, the majority of you are saying that it's increasing. Good, good, good. And then the last question, is there a relationship between substance use disorder and mental illness?
Your audio sounding good right now too. I like it.
Working it. True or false? Good deal, good deal. Absolutely. Thank you, folks, for that. So if I can share with you, we're going to talk a little bit about what you all perceive and what's kind of going on. While we're talking about this, here's what I'm going to invite you to do. In the chat box, and as I shared with you at the beginning, we're going to be utilizing the chat function throughout, but because I think your voices are very important, I want to ask you the question, how has COVID-19 affected your priority substance use disorder challenges that you are addressing in your work? So just how has COVID-19 affected your ability to do what it is that you do? Have that conversation in the chat. Dave will be engaging with you there as you're listening to what I will share with you as part of what's going on in our national conversation. So there is a good bit of concern that COVID-19 is really having this perfect storm effect on the progress that we've made. Particularly on the opioid epidemic, but I would suggest on all of our work. As you can look here, you will see this. These are data that I found from the CDC that I just got last month. And you will see the trend of overdose deaths in our nation are going up. And if you break that down, you see something really interesting. What's the hole in the conversation that we are not hearing about? If you break this down according to race, you will see that while the trend has gone up precipitously with whites, there very recently has been some recent success, some mitigation has taken place. While on the other hand, for Blacks and Hispanics in our communities, we are seeing a consistent upsurge that is continuing to put those communities at risk. What aren't we seeing as a part of that conversation? I'll share that what we may not be seeing is that the access to treatment that we have always have issues and challenges. The overall population are actually half as many that are accessing that if you happen to be Black or Hispanic. So the challenges having the substance abuse treatment of the overall population are only exacerbated that much more for people of color. And this happens for very known reasons that we aren't talking about as much. And again, I find this as being part of the whole discourses that we are having as a nation. For example, we know that there are existing impediments for African Americans, those communities of color, due to this determined health that plague these communities that are at higher vulnerabilities. We know that there is lower access to needed treatment, that they often terminate that treatment prematurely, much higher than the white population does, and that these opportunities in these areas are often less culturally responsive, and so therefore another impediment to their continuing ability to access that. We also know that limited access to prevention, treatment, and recovery services are happening at a much greater rate. And as a result of that, in recent years, we're seeing a great increase in overdose deaths that are occurring with these populations. And that is borne out to be true. In fact, as of 2016 and 2017, the death rate among African Americans in urban counties far outpaced every other racial and ethnic group. So we are not having those conversations in the context of the work that we are doing. Many of you will recall that we had very recently been paying close attention to vaping injuries and deaths that were happening as a result of vaping. And again, I go back to what Kennedy shared with us. The illusory gains are here now an example of themselves because we keep chasing kind of the new epidemic, if you were. These numbers actually represent those that I was able to get right before the COVID crisis really forced a lockdown and impeded our ability to have those data. But this crisis du jour is really impacted again by COVID as everything else. Whether we're talking about marijuana, whether we're talking about alcohol, whether we're talking about the issues and the challenges of folks relapsing, or the issues and challenges related to vaping, the current coronavirus epidemic has impacted all of our work in very, very meaningful ways. And so let's put a little bit of a point on some of the challenges that we are facing as a nation and what the realities are. Here you have data that was recently shared by the administrator of the Substance Abuse and Mental Health Services Administration, Dr. McCants-Katz. And when she shared these data, one of the holes that was really determined in the conversation that we ought to be paying more attention to are the number and the rising number of young people 18 years of age and older who were experiencing both substance use disorder and mental illness. And paying attention to that fact is something that we as preventionists really ought to be looking at. There are and have been some successes with alcohol initiation, and as I mentioned, among young people, a declining rate of young people who are demonstrating alcohol use disorder. And much of that is driven by the great work of community coalitions throughout our country prioritizing this, seeing a reported 27% reduction among middle school students and 23% reduction in high school students. Very important progress. But as my grandma used to say, sometimes you take 2 steps forward only to experience 1 step back. You can see here from this chart that as it relates to illicit substances, particularly marijuana, there has been a significant increase in use in the past year. I've already talked about the opioid crisis, but I will share with you that one of the things that we are noting with respect to the opioid crisis that the CDC defined in waves is that there is a new wave that is now needing some real attention that is not really achieving that attention. Psychostimulants and cocaine being involved in a number of rising deaths that are occurring around the country are showing that we really ought to be paying attention to something where even the CDC is sharing with us. Policymakers in DC are continuing to fund attention to the opioid epidemic while missing this new wave and issue that is affecting many in our country within the West and the Midwest of our nation. I also want to state that we may be also misapplying some of our attention. There's been a lot of attention. This chart shares with you the number of young people 12 years of age and older who misuse prescription pain relievers in the past year. In the blue is represented by those, that misuse source being related to either prescription or the malpractice of prescription drug or prescribing practices and the like. However, and there's been a lot of attention paid in this, a lot of attention being paid to how we address that challenge. But this greater portion of the pie that you see here in gray really represents the real danger in our society, where most of these young people are sharing that the source of their prescription pills is friends and relatives. And there's almost no national conversation around that. Here's another area where I believe preventionists need to be attentive to. And if I can take just a moment or so to share with you a little bit about about marijuana and what's going on in our society around marijuana. A lot of conversation around the nation about marijuana, but one thing that we aren't having a conversation about is the fact that marijuana use in our country is becoming much more commercialized. It's a $50 billion business. We are having conversations about this, but the reality, and thankfully to our good friends at this Smart Approaches to Marijuana, is we really ought to be paying much more attention to this reality and the norms that they are creating. So it's not merely the level of THC that we're wanting to pay attention to, but it's the normalization that's really occurring in our country that is leading to an unprecedented rise in the misuse and use of this illicit substance by our young people. So marijuana use in the past month is really going up among 18 to 25 years old. If we pay attention to that factor, we can see here that past year daily and almost daily use is continuing to rise. But if we look at that even closely and look at the differences, the distinctions between male and female, males are actually going down. But our females is where there ought to be a focus, because there is consistent trend of increasing use among our females. And Samson really did a great job of paying attention between pregnant women and non-pregnant women to really see where the challenges are. There's been a lot of attention being paid to those young women who are pregnant, and we can see the effect of all that attention and resource. That's great success. But where we are seeing that folks may be falling through the holes that we're talking about here are the non-pregnant women conversation here. So a lot going on there around that. So I want to share with you a couple of key points. I'm going to go through some data that are actually representative of research being done by Drs. DuPont and Dr. Madras, who was in that picture I just shared with you. And they asked a very key question. Is the use of one substance by adolescents associated with increased risk for using any other substance regardless of the use sequences. In other words, is using one substance associated with an increased risk of using any other substance? And they also asked a second question, which is non-use of any one substance associated with the decreased risk of using other substances? And here's a very interesting thing that they found. They found when asking that question, if a young person indicated that they had indeed engaged with marijuana in the past 30 days, and they asked that young person, did they also use alcohol or binge drink or had heavy alcohol use or cigarette use or illicit drug use? When the answer was yes, here is the response to that. When the answer was no, there was very minimal engagement in using other substance. And the interesting aspect of that is that whether we were talking about marijuana or alcohol use, as this chart is indicating, or cigarette use, as this chart is indicating, the effect was the exact same thing. And the indication of that, when we look at this NISDA data that I'm sharing with you now, what it says is that there is a serious risk for polysubstance misuse. Our conversations has been almost exclusively about one substance versus another substance. Opioid use or marijuana use, alcohol versus meth or cocaine, when in fact, the whole in our national discourse is around paying attention to polysubstance misuse. There is a clear indication that any use of one substance is a clear risk or predictor of use and activity with other substances. Here it just shows where there is no past year marijuana use in red, or any past year marijuana use in the blue, or past year daily or almost daily marijuana use, and you indicate that with opioid, alcohol, cocaine, meth, or any other substance or challenge, you can see the greater the marijuana use, the greater the problem. And this is not about a conversation about marijuana exclusively. This same pattern is repeated regardless of the substance or the initial substance misuse that we're talking about. So this is really where we have the challenge of gateway drugs impacting our young people and their engagement in our efforts. So I'm going to skip through a few slides here. So don't worry about my skipping through because they're only reiterating the point that I'm making here. But I will share with you that a lot of what it is that we need to think about is how do we reframe our ideas about prevention if we're going to deal with these challenges. And I would say that we need to go beyond thinking exclusively about these different frameworks and these different tools. And engaging folks has to be about more than understanding the 40 developmental assets or social determinants of health or SBIRT, right? Much of the time when we're talking to our communities about all of these things, we sound like we're speaking Swahili to them, right? They are not understanding the fact that we're bringing tools to them. When in fact, what we really ought to be sharing with folks is what I refer to as a much more clearer conversation about what is our why. What is it that we're actually intending? And in this way, I share with you that during this current time, we are indeed paying attention to preventing deaths, right? So we have to have a conversation about overdose prevention. Of course we do, right? But we also have to have a conversation about looking at our treatment efforts and how do we redefine what success in treatment and long-term sobriety looks like and consists of. And that may mean that we are paying attention to relapse and relapse prevention in a way and articulating it in a way that we are currently not doing so. And then lastly, And just as importantly, is the notion that we have to pay attention to primary prevention in a way that we just clearly aren't these days. And when we speak about it, we have to be clear about it. It's not merely about a framework, it's about the why behind what it is that we're doing. And that why I will submit to you is that we are purposefully and intentionally looking at preventing addiction. Primary prevention has often been framed as prohibitionist, right? And we're not prohibitionists. We are focused on our end game, and our end game is really preventing addiction for who? Our most vulnerable population, right? And so the roles of coalitions and prevention providers during this COVID-19 time, I suggest to you, are fivefold, right? We can do this by paying attention to how we build protective factors and resilience, how we look at addressing specific local conditions, what's going on in the context of our society, engaging and supporting youth and families in communities, paying attention to providing information in a way that is clearly evident throughout the societies, and coordinating those resources for prevention, such as the Prevention Coalition in Sussex County, for example, or the PIC project and effort that you have, providing information for parents in ways that are meaningful through some of the efforts of the state. You all are doing such a remarkable job at looking at this. But if we're going to pay attention to this and pay attention to this well, we really have to engage and think about how is it that we engage the broader community in that conversation in meaningful ways. And so with that, I'm going to end my presentation now and simply say to you that you all are remarkable to me in the work that you do. I thank you for how you're adjusting to the work that you're doing through these very challenging times. I want to open it up for any questions that you might have, but the real hope for this presentation is to provide some encouragement to think about how do you reframe what it is that you're doing in a way that hopefully can invite others to participate in this conversation much more meaningfully. And with that, I'm going to stop sharing so that I can hopefully see you all and hear you all better, and see if there are any questions that you all might have for me with the few moments that we have remaining.
All right, folks, and you should be able to unmute yourselves as well if you would like to use your voice to ask a question. Or feel free to put it in the chat box.
Unmute yourself, folks.
All right, so Karen says, thank you so much, Carlton. Sorry, she's got to jump off. Hosting a meeting at noon. Back-to-back meetings is tough. Zoom
Yes,
fatigue is real. Glad you were able to join us.
Thanks so much. Are there any questions at all or any thoughts?
Got a thank you from Mildred.
Thanks, Mildred.
Right.
Appreciate you.
All right.
Well, with that, I will take that as there are no additional questions or no additional thoughts we have with this. I want to thank you all for the time that you provided to this. I'm going to see, Abby, if you want to have any closing remarks. And I want to thank you again for your support for this, and looking forward to you all and seeing you all the next time. But thank you all so very, very much. Abby, I'm going to give you the last word if you're there.
I'm here and I don't have much to add. Thank you so much, Carlton, for this great presentation. And thanks everyone for joining us today.
Fantastic. Thank you, guys. Dave, thanks so much for your help and your support. Take care, everybody.
All right, just us.
Just us. Hold on, hold on, hold on, hold on, hold on. Where are we? There you go.